Hello, this is the American Medical Association's COVID-19 update. Today, we're going to learn about a national grassroots campaign called This Is Our Shot, which aims to elevate the voices of physicians and other healthcare workers in an effort to get people vaccinated. I'm joined today by Dr. Alex McDonald, co founder of the hashtag This Is Our Shot campaign, and a Southern California Permanente medical group physician specializing in family medicine and sports medicine in Fontana, California. Dr. Anna Yap. This is our shot design lead and an emergency medicine resident in Los Angeles, California, and Riley Beeler, the AMA's Government Relations Advocacy Fellow or GRAF in Washington, D.C., and a rising third year medical student at the Elson Floyd College of Medicine at Washington State University. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Dr. McDonald, let's start with you. Can you begin by telling us what This Is Our Shot is and how the idea came about?
Absolutely. So this is really our job is to elevate the voice of healthcare heroes to really build vaccine trust for a COVID-free world. This started from basically a friend of mine and I kind of had a conversation and realized that Kaiser Family Foundation data showed that physicians, and not just any physician but your physician, is the most trusted messenger when it comes to COVID vaccine information and messaging too. So what we really wanted to do is basically empower healthcare heroes, whether that be doctors or nurses or pharmacists, whoever it is, to reach out to their communities, to their members, to their friends, to their family, and really share accurate and good information about the COVID vaccine too. So our job is to help train and educate those healthcare heroes so that then they can go out and talk to their networks as well too. So that's the short version. I could go on and on, but I'll stop there.
Well, it is really inspiring, and I've gotten to know a lot of physicians, residents, and students over the years here at the AMA, and I am elated when I see them getting their shots, and it makes me want one even more. Dr. Yap, Ms. Beeler, how did you first hear of the campaign, and why did you feel it was so important to get involved?
I'm actually friends with Alex and the other co-founder of Tool, and they kind of approached us in California and saying, "Hey, we really want to start this movement of healthcare heroes," and their energy is so contagious, and they really just pulled us into this movement, and it's been just on the ground ever since.
How are you getting, how do you get people involved? Is this a thing that's kind of organic just by seeing it, or what are you doing to market it?
Yeah, so the way we do it is we have weekly meetings on Tuesday evenings that we can pull people into, that we invite people into. And when we have these meetings, we say, hey, bring three of your friends, text them, see if they're interested, and help them come along. Also, we have Facebook pages, Twitter pages, and kind of all that. We try to generate a buzz and bring them into that movement.
Ms. Beeler, how'd you get involved?
Yeah, it was the most typical grassroots efforts where you hear word of mouth. Dr. Yap is one of my close friends and AMA colleagues, and I have several other AMA colleagues who are involved. And they said, hey, we are the ones on the front lines battling COVID-19. We also have to battle it in our own communities when it comes to vaccine hesitancy. And I just fell in love with it right there because grassroots efforts are the most effective, passionate types of advocacy campaigns.
Yeah, vaccine hesitancy, a real issue here. Dr. Yap, I'd love it if you could comment on a recent article about the campaign. It said that the single greatest barrier now facing us is vaccine trust, especially among communities of color, younger individuals, and lower socioeconomic populations. It's surprising to see younger people on this list. What is driving the hesitancy there?
It's so multifactorial, right? And if we had like the single right answer, we'd be able to fix it right away. But the truth of the matter is we don't. I mean, there's a lot of historicity to this with communities of color that unfortunately have dealt with racism in medicine and other, things that have lost their trust, understandably. And that's why we as healthcare providers have to reach out, have to put out that olive branch. And that's what our group is working to do.
hmm Ms. Beeler, what are you seeing or hearing among medical students? Has there been any hesitancy, to get the vaccine? I know it's kind of hard to generalize across, that many people, but, why is it so important that medical students get involved in efforts like this?
Yeah, no, it's actually quite the opposite. We're seeing medical students wanting to get vaccinated. Our third and fourth years a majority have been vaccinated as they're the ones that are in clinic. But we also see our second and first years who are in their preclinical educational years wanting to be vaccinated, wanting to protect their community in every way that they can through, protecting themselves, which in turn provides immunity for themselves and protects their families, their friends, those that are around them.
I
And
imagine
just
it's going
like
to be an important part of like getting back to normal in their education and training. Is that, part of the motivation?
Definitely. And like Alex or Dr. McDonald said, 85% of patients said they trust their own physicians to disseminate information regarding COVID-19 versus 58% of others who trust officials, government officials, and
Hmm.
things like that. So, medical students know that they are the future physicians and want to be part of that communication platform.
I think
Again,
the medical
you hit.
students are So I think the medical students are so key. And when Dr. Nagasi and I sort of launched this effort, we thought about, okay, how can we really engage these medical students who maybe have a little bit more free time, not much more, but a little bit more free time, and are also very, very digitally savvy and social media savvy, right? Because this is primarily a digital effort, right? This is primarily through social media. And so really harnessing the power and the knowledge and the experience of our medical students and our future physicians is so key. And we partner with the American Medical Student Association as well, because that's such a valuable key ingredient into this grassroots effort.
Dr. McDonald, when you see, other healthcare workers being hesitant about the vaccine, you know, how do you react to that, and what do you do about it?
I think it's all about conversation and it's all about trust. One of my nurses actually was very hesitant about getting the COVID vaccine until I got mine. And every day she'd pop her head into my office and say, "Hey, how you doing today? How are you feeling after your COVID vaccine yesterday, 2 days ago, last week?" Right. And so it's all about those individual relationships. And, probably about a week after I got my second dose, she popped her head in and said, "Dr. McDonald, I got my first dose." Right. And so it's all about addressing individuals where they are, reaching out to them. And as Dr. Yap said, it's really so multifactorial that we can't use a one size fits all approach. We need to basically ask questions and see what's driving patients' individual hesitancy and address their concerns in the individuals one at a time.
Dr. Yap, anything to add to that?
I mean, I think that a lot of times we as healthcare professionals, there's a group of us who are like social media savvy, but I think a lot of us don't realize the power that we have on social media. And all the people who are actually watching you that you don't realize. So when I posted this shot, my vaccine stuff, I actually had people from high school who I haven't talked to in like ages actually reach out to me and ask me questions about the vaccine and ask me things like, are there animals in this vaccine? Or is there this, is there that in the vaccine? And I helped quell their fears, and they got their vaccine pretty recently, and I'm really excited to see that they went forward with it. So the part of our movement is also to help empower and help give our healthcare professionals the tools they need to be able to reach out to their groups and their communities.
Well, we know that physicians struggle with how to message the importance of getting the vaccine in a way that will resonate with their patients. And of course, not everybody's the same. There are different reasons, I think, that you've mentioned. But a little lightning round here. What's the number one reason that you tell patients or your friends or your family why they should get vaccinated? Dr. McDonald, you first.
So first, I lead by example, and I show them my selfie. I post it on social media, right? Second of all, I tell it, do it for your grandparents, do it for your kids, do it for your community, do it to get back to normal. Hence the name. This is our shot. It's for our shot to get back to our normal life, to protect our communities and to protect ourselves.
Dr. Yap?
He couldn't say it better himself. Like I just want to get back to normal. I'm tired of all this. So let's work together and let's move forward.
And Ms. Beeler?
Exactly what Dr. McDonald said. This is our shot. We have a responsibility together as a planet, as a nation, to get this vaccine, to fight COVID-19 so we can protect each other.
Dr. Yap, you mentioned, the fact that you're in that kind of contingent of social media savvy physicians. Obviously, social media has been a double-edged sword here. How's it helped you and how's it hurt you in terms of messaging about the vaccine?
It is where the anti-vaxxers do live. And unfortunately, we have had some individuals in our campaign actually be targeted by individuals in that group. And a lot of times there's the problem of, in social media, you don't necessarily change people's minds if you don't know them, if you don't have a personal connection with them. So there is that dark side to social media, but I think the bright side is there is a very large community that you can reach on there that you know throughout your life. And especially in this age of social distancing, that we can't see each other, social media is the way that we can reach out to each other. So that's where we have seen bright things in social media.
Dr. McDonald, any thoughts for you about the role of social media?
Absolutely. I mean, my wish for this campaign is that every single physician in this nation will raise their voice and start posting good, accurate information on social media and within their networks. Maybe if they're only friends with their grandmother, right? It doesn't matter. It's one at a time, right? And only collectively together can we really combat not only misinformation, but horrific and dangerous misinformation. We know the anti-vaxxers are extremely well funded and extremely well organized, and we really need to reclaim the narrative. We can use this moment in time, let no crisis go to waste. We can use this moment in time to recapture the narrative on vaccinations in general too. So that's my dream, is that every physician can be educated and empowered to speak out and to speak up to provide a counterpoint to this dangerous misinformation.
Dr. McDonald, both you and Dr. Yap have brought up this idea of being, the possibility of being harassed and trolled by anti-vaxxers. Do you have any advice for folks who, that's a real fear for them to do what you're hoping they do, which is get up and, speak out?
So we actually had a fantastic Dr. Baldwin come in at our last meeting to actually talk about being trolled by anti-vaxxers. And at each of our weekly meetings, we actually bring experts in to kind of teach us more about various parts of the campaign and how to become better social media advocates. I think the important thing that she brought up was just like, a lot of times just don't engage with them if you can, and understand that we do have a larger community that's here to help support you and help to keep you safe too.
Dr. McDonald, any thoughts on dealing with trolls and, strong harassment and opposition online?
Yeah, I mean, there's a couple different groups that you can go to for help. One is called Cicada, one called Shots Heard. There are different websites and Facebook groups where individuals can get support and help for this as well. Part of our mission too is to help empower and to educate our coalition and our members of this grassroots effort and provide them the training and the tools. I mean, I think in a word, don't feed the trolls, right? Mm-hmm. So just ignore them, block them, don't even pay any attention to them, because all it does is if you activate them and comment on them, all it does is it feeds into their cycle, and through the social media algorithms actually raises their posts higher up, and people are more likely to see them as well. So don't feed the trolls.
Good advice. Do not engage. One of the first and most important lessons of social media. Kind of final question here. Each of you respond, please. What inspired you most since starting or becoming involved in this effort? Dr. Yap, will you start?
I think I'm just inspired by all the other healthcare professionals who have really jumped in on this and taken this mantle up. It's inspiring to see people's posts and the things that drive them to make this is our shot, to say that this is our way of moving forward.
Ms. Beeler?
I think in this current climate of division, this is our shot has really put in real life experiences, such as, I got my shot. I had chills the next day, but it's okay. My body is fighting the virus. That's what it's doing. It's not blaming people or getting angry at people for not getting their shot. That's really trying to provide a platform where you can ask questions, where you can get information without feeling bad. And I just love that my fellow colleagues are working together to really try to make the community better in a holistic way.
Dr. McDonald?
Yeah, I would completely agree with my illustrious colleagues here. I think the number one thing that's inspired me the most is just how everyone is so positive, right? This is really a campaign about being positive and not ignoring the negative, and a lot of bad things have happened over this past year, but we're just taking where we are and moving forwards and thinking about the positivity. So the energy, the enthusiasm, and just everyone just sort of gets it, right? After when I first talked to people about this movement, they're like, yeah, I'm in, right? It doesn't even take a heavy lift because people are so excited.
Dr. McDonald, for those out there that would like to get involved, what should they do?
Absolutely. So we have a website which is in sort of beta form right now, hopefully launching soon. If you go to thisisOurShot.us, there's a form right there that you can log in, put your information in there to be added to our email list and our invitation for our weekly meetings as well. Go online, go to at This Is Our Shot on Instagram or Twitter, and then we also have a Facebook group for physicians specifically. If you go to search This Is Our Shot Facebook group, you can actually ask to be joined to join to that group, and where we do a lot of our internal organization. And then we also have a public Facebook page as well too. People can search This Is Our Shot 2021 and join for more public messaging there too.
Well, thanks so much, Dr. McDonald, Dr. Yap, and Ms. Beeler for being here today and talking about This Is Our Shot. I love what you're doing. I'm so inspired by it, and I want to see more pictures of all of you getting those shots. Thanks for joining us today. We'll be back with another segment shortly. In the meantime, please take care. Bye-bye.